So it gets to that stage during step 1 prep when we feel we have done UWeld and then we have read first aid and our scores are still not improving. One thing that we forget is taking note of our weak areas. Some people are not able to even identify their weak areas. The most important thing that would make your scores to improve or increase exponentially are working on your weak areas and also doing spaced repetition. But in this video, I'm going to talk more about how you can work on your how you can identify your weak areas and work on it. So there are two most important things that I did that really helped me, because when I was doing step 1 initially, I had finished almost all the resources and my scores were still not improving. So the first thing I did was I took the rapid review. Like I took the first aid and then the rapid review session. So this is what I did. So if you open the first aid and then you go to the rapid review session, you have this column and then you have this column. So now what I do is this column reads whatever they want you, like the buzzwords or like the explanation or how the question may present, and then the answer would be here on this side. So what I did was I'll cover this side and then read this. So when I read and I write down the answer that I think should be the correct answer here. So now when I do that for all here, and whatever I get incorrect means that it's my weak area. So that's what I did. So I did that for all the rapid review, and then it was able to tell me what exactly I didn't know. So then I went back to pathoma and the first aid. Usually I did a little bit of the first aid, but pathoma mostly to work on those areas. And so that really helped me, especially for renal, cardio. Renal must be very good in order to do well on step 1. So yeah, that is one thing I did. And the second thing that I also did was to do the RX, USMLE RX questions. So a lot of people say, okay, I can look through first aid and know which areas I'm weak at and work on it, but it's not so for many people. So what I did was I knew that the USMLE RX, the questions are just like first aid, and they're like more directly from first aid. So what I did was I subscribed to them. I think that time it was like $30 for 1 month. So I subscribed to them for $30 for a month, and I decided to do their questions. So I did over 1,500 questions within 1 week. So it was like I just sit down and do about 4 blocks in a day with speed. This time you are not focusing on getting the questions correct, but you are trying to see if you are working on the speed on the exams, whether you can get them correct or not. So if you miss them on RX, it means that you don't have a good foundation in those topics. So those are your weak areas. So that's what I did. I sped through the USMLE RX questions, and whatever I got wrong meant that it was my weak area. So when you get the scores at the end, after doing a block, when you get the scores, you will realize that the RX will give you some pointers, like where they'll give you your area. So they give you the green bars. They'll give you some bars to identify your how strong you are. So they'll give you green bars, they'll give you yellow bars, and they'll give you red bars. So mostly I worked on the red bars, meaning that those are my very weak areas. So after the 1 week, I took the first aid, and then I read through those areas, and I also did a little bit of a B&B videos on those weak areas, and then I came back to RX again to see whether there is an improvement, and of course there was an improvement. Also, you make sure that you review the RX explanations for those questions that you got incorrect, but focus more on the topics that you had red bars in, and that is the things that really help me going forward. Also, if you are someone who is still not able to do this, I would say, I would say, first of all, if you don't have money to subscribe to RX, then what you can do is to maybe they have this free subscription, and so you can decide to subscribe for free and do that within one week. I think they'll give you like 5 days or so. Why I didn't say amboss is that amboss is not really the thing to identify your weak areas. The best resource to identify weak areas is RX, so you can try that. If you're also someone who, like, your exams are so close and you don't think this would work for you, then I'm going to put some topics below in this video. Check the description and look through these topics. They are very high yield. If you look through them and then you ask yourself if they are good at them, if you're not good, take a quick review at them before you go into the exams, and then you are going to perform well. Thanks for watching this video. Kindly subscribe and share with your friends. Bye. Good luck in your exams.